We chat to psychiatrist Dr. Gwen Tonyane about the mental and emotional effects that our healthcare workers experience working in the front line. Welcome to the Loft, Gwen.
Thanks for having me.
Now, doctor, with your experience this far, how does being exposed to this virus on a daily basis affect our health workers?
I think with COVID-19 and the pandemic, it's been challenging. It's been difficult for everybody, but it's also been rewarding to a certain extent because it has given us almost a moment to sort of reflect and realign our purpose in terms of why we became doctors in the first place, and why we went into this noble profession, even with all these difficulties. But it's also motivated us, to do things differently because we have to care for our patient, but we have to do it in a different way than we had done previously. We have so many limitations in terms of, that human contact, seeing your patient smile, because now they're seeing us, through these vices. Some of them they can't even tell who we are because we are so suited up, and that human interaction that we initially had, it's quite limited, that they probably only now have our voices as a way to recognize who they're speaking to, and our voices now, because the human touch is gone, that our voice sometimes it needs to be enough to relay the support, us caring, being compassionate and being empathetic with what they're going through. It also made us be innovative also in terms of how we care for our patients. We might be physically distanced, but emotionally we're still there for them. So, working from home remotely and still being able to administer care to show our support and that we are, going through this journey with them.
Now, doctor, this experience can be quite jarring, I can only imagine. And we have been speaking to doctors and healthcare professionals who are working on the front line throughout the show. But we want to find out from you, what are the common fears and concerns that they are experiencing?
I think the biggest concern is obviously contracting the illness and contracting the virus, but more the severe kind of the virus that threatens your life, that you could potentially lose your life. I think the other concern is, taking this virus back home, to our families. And the other, concerns, perhaps they've always been there, but they're now more highlighted, especially, I think, in the public sector. Will our healthcare system cope? I mean, if we lose one member of the team, the entire team suffers. Those are some of the things that are almost heightening our anxiety as healthcare workers.
Now, Gwen, we're going to touch on anxiety a little bit later. I just want to find out on a very practical level, how can the public support healthcare workers?
Oh, that is a very good question. All that I think we want the public to do is to please adhere to the physical distancing as much as possible. Stay at home if you can. Wear your mask when you're in public. If we can almost try lessen the amount of patients that are contracting the illness, we almost don't burden the health system and make the healthcare workers as anxious. And if you do have a family member that the healthcare worker, send a text, whether it's a motivational text, whether it's a religious text, to almost, fuel that fire and that motivation to still get up and go and do what we do every day, because it is difficult. Sometimes, we sit and we wonder, is it worth it? Is it worth me going? Yes, I'm doing a noble thing, trying to help others, but I'm putting myself at risk. Is it worth it? And sometimes, that one text, that one phone call can mean so much to the healthcare workers, to say, you are on the right track, please keep going. And all the love that we're getting on social media, on the platforms, we really appreciate it. It's one of those little things, and we're sitting in our coffee in the doctor's room, it makes us laugh, that sort of jokes,
Yes.
that makes us want to keep doing what we're doing.
Yes, doctor. You know, I love the fact that you are quite open and honest about the fact that sometimes you have to question yourself, your purpose, and am I on the right path? I do have some family members that are in the healthcare profession. Thank you for the reminder that that text, that phone call could be the difference between them giving up and pushing forward. Now, what would you suggest for someone that has extreme anxiety, like someone who won't leave their home, or for someone that will want to wear full PPE clothing should they need to leave their home?
You know, the PPE, the full PPE, is sort of reserved for us as healthcare workers, or maybe perhaps patients that, or professions or persons that are administering care or working closely with patients that have contracted COVID-19 and are in need of medical help. And usually this is, you know, interventional type of care where whether they're in ICU or ventilators, where there's risk of, you know, body fluids or blood that, you know, the healthcare professional can get. But sufficient, I mean, the surgical mask or a face cloth mask currently is sufficient. You know, washing your hands regularly for over 20 seconds is sufficient. Keeping your physical distance, staying at home as much as possible, and limiting social interaction, and going out only when you need, you know, essentials, whether it's food. If you can work from home, doing that as much as possible, that should be sufficient.
As a psychiatrist, let's delve deeper into the advice and the feelings that we see here emerging. What advice can you give to our viewers to minimize their anxiety and fears around COVID?
The first thing is to acknowledge these difficult emotions, all right? Acknowledge the emotions, name them. Speak out your feelings. As I'm saying, I'm feeling angry, I'm feeling anxious. And if you need to talk to somebody, you know, whether it's a healthcare professional or somebody else, a family member, a friend, talk to somebody, acknowledge the fear. And sometimes, you know, when you do talk to somebody, already in its own is therapeutic. Once we accept what we don't have control over, we take the power out of the situations and out of the anxiety. We take that power, and, you know, it's about being in the moment. And that's what anxiety does. This thought comes and it's negative and it consumes you so much that it becomes almost paralyzing, that you can't do anything because all you see is negative, and your outlook on the world becomes negative, and all the positive things that are happening, you start minimizing them and stop seeing them. So, you know, sometimes reaching out and talking to somebody, they can bring you to the here and now, you know, and by bringing you here to the here and now, they center you to think about what are the positives that are going in your life, counting your blessings. I am healthy, I'm safe, I have X and Y and Z going for me. You know, let me concentrate on that. You know, let me concentrate on the people that have contracted the illness but have recovered. You know, yes, there's all this negative things happen, but there's also positive stories coming out of the pandemic. And, you know, sometimes when it's so overwhelming that it consumes you, that you know, even you start having physical symptoms, your heart starts beating much faster, you know, you start having physical symptoms, gastrointestinal symptoms, you know, this choking feeling, that is when you should seek medical help. Don't sit with these difficult feelings, because soon that anxiety can become a physical illness, and that physical illness can actually decrease your immunity, and you end up contracting COVID-19, or you end up with other medical illnesses. So when it becomes overwhelming, please reach out, talk to somebody and ask for help. Don't go through this alone.
It's very interesting, the fact that you can now have physical manifestations of emotional feelings, feelings of anxiety, feelings of worry, feelings of stress. So to minimize that and to make sure that these feelings do not manifest into physical symptoms of sickness and ailments, let us seek the help and speak to professionals like you. Thank you, doctor.
Pleasure.
We appreciate all your help. Goodbye. Now, everybody in South Africa, don't be afraid to seek the help and ask for advice if you feel like you can't cope with the fears and anxiety. And in the words of Dr. Tonyane, it's okay to be a human hero.